30-second thumbnail is audio-visual neuromodulation. Put on, turn on, pulses of light, pulses of sound, specific frequencies of patterns in the brain, and sleep. So neuropathic pain was our de novo approval January 16th, and that was after a 10-year journey getting there. I think first you've got to find your niche people that are going to support you, because we had great support from your folks. We had great support from Brain Mind, and Portfolio, the text that goes after women's health, and those particular sort of little groups are even more essential now, including yours at the earlier stages, because you're not what I was getting from the VCs was, great, we're interested, but we're not going to come in until you're post FDA. Well, ours is basically so similar to the clinical bit, where you want to treat every bit of data acquisition as a step up the ladder, rather than a bar you have to cross. What's working for us now is to apply the same approach to the reimbursement pathway and ask the question of, okay, what are the hypotheses you can test, and what is the cheapest, quickest, easiest way for you to test those hypotheses? Because we're just switching in for commercial bit now, our primary experience is, what do you need to get through the FDA? And that, when it's completely novel, that is really hard. It's always going to take longer. All of my existing investors sort of breathed a huge sigh of relief, and then came up with a lot more support as soon as that FDA approval was through. Of all the things you can skimp on as a startup, your patent protection is not one of them. So please, everyone who's coming up with something new, make sure that bedrock is in place.